Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Welcome back to this week's episode of The Feds. I am Stephanie Weidel. Before we begin, please go ahead and like, comment, subscribe to, and share our podcasts. Go ahead and visit our website where you can donate towards our mission at fedsforfreedom.org. Today, I am joined by Dr. Paul Thomas, a retired pediatrician out of Oregon. He has quite a story about the Oregon Medical Board coming after his license. He has written several books, including the Vaccine-Friendly Plan and the recent Vax Facts, What to Consider Before Vaccinating at All Ages and Stages of Life. Dr. Paul, which he likes to be called, is a wealth of knowledge and insight into the needs of children and parents. Thank you so much for joining me today, Dr. Paul.
Oh, thank you, Stephanie. I'm so glad I get to meet you.
Oh, well, Dr. Paul, in the years before your retirement, you departed from the typical direction that pediatricians often take by actually informing parents of the risk of vaccines. Were you always this kind of pediatrician?
No, it was a journey, Stephanie. I mean, some people are lucky enough to have been born into a family where they were questioning vaccines from the get-go. That wasn't my story. I mean, my parents followed of course, I'm old enough that I only got like 3 as a child, I think. So, the schedule has blossomed. But I went to Dartmouth Medical School, went through residency training in California, was board certified pediatrician for 30 years. I initially believed that vaccines were the most important thing a pediatrician could do to ensure healthy children. And unfortunately, that is still the belief of most pediatricians today. So I had to go on this journey of figuring it out, basically. And that was a process, and I'm certainly happy to talk about that.
Yeah. Well, I was first introduced to your name through the Vaccine-Friendly Plan, the very first book that you wrote. And I remember in 2020 reading it. My mom gave it to me, reading it outside with my children playing around me. I was pregnant with our third and being absolutely horrified when I got to the part about autoimmune. If you have autoimmunity in your family, stay away from shots until you're 5. And that's when I realized, wow, my husband is probably a vaccine-injured child or adult, but injured as a child.
Yeah.
Just looking at his background. So I can't thank you enough for writing that book. But at the same time, I was hearing that you are actually departing from some of the thoughts within your book, that you are getting to the point where you're saying no vaccine at any time is a wise idea. So would you go into that a little bit?
Sure. Let me set the stage. So in about 2000, I personally started questioning, why are children so sick? And then in 2004, 5, 6, and 7, as I described in the Vaccine-Friendly Plan book, I personally, in my own practice, had a child who was completely normal at 12 months or even 18 months. And by 2, they were nonverbal, severely autistic. And it was like, wait a minute, what is going on? I saw no autism as a child. I saw no autism growing up. I saw no autism in medical school. I didn't see a severe case of autism even in residency training. And you have to understand, when you're in residency, you're seeing the sickest of the sickest. So something had changed. And the NIH and the CDC and all the institutions that were trying to figure out autism were saying it's genetic. And that made no sense, because you don't have genetic epidemics. It had to be something environmental. So common sense just kicked in. I'm going, we have to figure this out, and we have to look at what we're doing. I remember a medical school lecture where they talked about iatrogenic disease. What we do as physicians can cause health problems. But somehow for autism, this was not being looked at. It was like, oh, vaccines are safe and effective. We're not looking at the vaccines. It's that science has been settled, which that statement is as ridiculous as any could ever be made. Science is always progressing. You learn more as you go forward. As we added more and more vaccines to the schedule, that changed the toxicity profile that children were exposed to, which could well explain why we have now seen this massive rise in chronic conditions. So I was waking up in the early 2000s, having those patients of my own, writing about that in my book, The Vaccine Friendly Plan, that came out in 2016. That sort of set the stage to going, wait a minute, there's a problem here. You mentioned autoimmunity. Schoenfeld wrote a book, Vaccines and Autoimmunity, that was, hundreds of references. And that woke me up to the fact that, whoa, this is aluminum. We had been looking at mercury. We've been looking at a lot of factors, and mercury is bad. We don't want mercury in vaccines, period. I think it was part of the problem. But aluminum is still in the vaccines at massive toxic levels. And aluminum has been proven to trigger autoimmunity. They even use aluminum at vaccine doses, by the way, to trigger autoimmunity in rats. When they're studying autoimmunity, you can create autoimmunity by injecting aluminum. Yet we are injecting these massive toxic doses of aluminum to pretty much every child in America and most of the world that follows, an aggressive vaccine schedule. So yeah, we have set the stage for a lot of problems. And so that's the background. You mentioned informed consent, and I need to make a comment about that. The physician you are sitting with when you go to a pediatric or family practice or whoever you see can only inform you to the best of their knowledge. And if their knowledge is compromised, you're not really getting true informed consent. And so as my awareness and knowledge grew, because I did a deep dive into this whole topic of vaccines, what's in them, why are we seeing all these chronic problems, I was able to give better and better informed consent, to the point where my new book, Vax Facts, is really the informed consent book. If you want to truly understand the risks and the benefits, you want to talk to someone who understands the science, that really gets it, so they can give you both sides of the equation. Pediatricians today are still saying vaccines are safe and effective, and there's nothing farther than the truth. Vaccines are extremely dangerous. Sometimes they're effective. It depends on which vaccine, when it's given. The effectiveness varies, but the safety of the vaccines, it's never been tested. So, that's a whole, when I woke up to that, you may have heard of the book Turtles All the Way Down. That book lays it out. I can summarize it in a minute. Basically, every single vaccine on the childhood schedule was never tested with a placebo, which means you should have the vaccine arm, which would be, thousands, tens of thousands of vaccinated kids compared to tens of thousands who are given saline, a saltwater, harmless injection. And you look at health outcomes. So they never did that with any of them. They never looked at all health outcomes. They only predetermine what they're going to look at, usually things that clearly won't appear in a short time, because they have also very short timelines of how long they're looking for these side effects, days in the case of some vaccines like the Hep B. So there's no placebo. They're not looking at all health outcomes. There's very short timelines. The whole thing, the whole safety testing is nonsense. It's non-existent. So you are an experiment. If you're choosing to vaccinate yourself or your child, you are enrolling in a grand experiment. And here's the other thing. They've never tested all the vaccines together. Like, the CDC schedule has never been tested for safety. It's like the dose makes the poison. Okay.
Yeah.
So when you have all these vaccines and so many of them contain aluminum, which in one vaccine, there's enough aluminum for it to be poisonous and harmful. Imagine injecting multiple 10, 20, 30, 40 vaccines that have too much aluminum. You have overwhelmed the immune system. You have overwhelmed the ability for the body to detox. And aluminum, once it's injected in your body, that aluminum that's there in a couple weeks has a half-life of at least 7 years, possibly longer, which means it's going to take you your whole lifetime trying to get it out of your system. It's very difficult to eliminate aluminum once it's in your body.
And do you know ways to detox? Because, and you say it's difficult, but there are a couple methods that people are promoting to detox, and I do wonder, do those actually work?
Well, detoxing heavy metals is a complicated topic, and I would recommend. I'm no longer board. Well, I lost my board certification when they took my license. That was just sort
And
of
we're
a
going to talk about it. Yeah.
thing that happens, and I'm no longer licensed. So everything I'm talking about here is, think of me as more Professor Dr. Paul Thomas, not Dr. Paul Thomas, who's giving medical advice. I don't give medical advice. I don't diagnose and treat. But when it comes to heavy metal detox, there are simple things you can do. I mean, you can take certain supplements that help usher toxins out of the body, boost your immune system, your ability to detox. But there are much more aggressive ways. Chelation, for example, you want to do that under the supervision of somebody who really knows what they're doing. That's a
Well,
complex topic.
what typical supplements are used to detox?
Well, I mentioned a bunch of them in my new book, Vax Facts, but I would say we're all vitamin D deficient, and vitamin D is very important for the immune system. So you need to supplement to make sure your vitamin D levels are optimal, not normal, but optimal, 50 to 80 nanograms per deciliter. Normal is 30 to 100, but most of us are way less than 30. We're all deficient. Then, for specifically for detoxing, N-acetylcysteine, NAC, helps boost glutathione, a major detox molecule. If you're going to use glutathione itself, it needs to be liposomal because otherwise it can actually backfire on you. And then selenium can be helpful. Um, Chlorella, you know, basically eating healthy is important. I mean, number one step to detox is quit putting more toxins in the body. So
Right.
you stop vaccinating, you eat organic, you drink filtered, well filtered water. I mean, you got to really look at what you're doing so that you stop putting toxins in. That's number one importance. And then you can start doing these other things to boost your own body's ability to detox. And yeah, like I said, that's a complex topic.
Yeah. Okay, well, back to your story. So you published this book in 2016, and then the medical board, the Oregon Medical Board comes to you. What happens?
Well, I'm thankfully have that nightmare behind me, but while I was going through it, I had a booming practice. We had a waiting list years long, people trying to get into our practice because we were doing something unique. We were truly informing patients of the risk and the benefits. And a lot of patients were choosing not to vaccinate. Not all. In fact, most patients did some vaccines, but I had enough patients not vaccinating that I was starting to see the difference, right? So most pediatricians have no clue how healthy unvaccinated kids are. So I'm noticing this, and the degree to which I was noticing it just sort of skyrocketed because pediatricians were doing something that seems unethical to me. It used to be it was unethical to kick people out of your practice if they weren't following the CDC schedule. But the Academy of Pediatrics changed and said, yes, it is ethical to kick them out because they're putting others in harm's way, which I'll address in a moment because the opposite is true. Basically, the unvaxxed are the healthiest by far. Healthy kids don't make other people sick. It's unhealthy kids who make other people sick. And who's unhealthy? The vaccinated, which my data shows, but we'll get to that. So anyway, medical board starts coming after me. I was getting letters sometimes weekly, at least monthly. And with each letter from the medical board, which by the way, you need an attorney. I've gone through 3 sets of attorneys trying to defend my license and my right to practice. I basically, in my opinion, did nothing wrong, but followed the data that I was seeing and was sharing the honest truth. So it's kind of almost a First Amendment thing also.
Yeah.
But they were saying, no, you have to follow this. You have to recommend the CDC schedule. It's unethical not to. And so this just kept going. And then finally in 2019, I got a letter from them saying, prove that the vaccine friendly plan is as safe as a CDC schedule. And I was thinking, this is ridiculous. They've never proved that this year's CDC schedule is as safe as last year's, but they want me to prove. So I was like, I don't know, somebody, and I don't remember who, they still haven't come forward and told me who. Somebody said, just do a quality assurance analysis of your data. So I thought, oh, that's good because you don't have to go through the rigors of an IRB, Institutional Review Board. Just this is an ethical thing to do. Stephanie, if every doctor would look at their actual data and compare, okay, we're doing an intervention here. It's called vaccination. Let's compare the vaccinated to the unvaccinated and see what the difference is.
Yeah.
We need to do this in medicine. So that's what we did. And Jack Lyons-Weiler helped me analyze the data. I provided the data. We had 2,700 partially vaccinated, and then we had 563 unvaccinated. And we looked at the appearance of all health conditions over the 10 and a half years of that data set. And we made this set equal by, I had fewer unvaxxed, 563. So we had to multiply that number by 5 so that we were really looking at the same number of events. And what we found was absolutely dumbfounding. I mean, I had a sense we would find this, but to actually see it, Stephanie, to see that the unvaxxed have 1/4 or 1/5 the asthma, the eczema, the allergies. They had 1/4 or 1/5 the neurodevelopmental issues. So you're talking 80. Well, actually, the unvaxxed in this particular sample had 0 ADHD, and the ADHD in the vaccinated just skyrocketed. That was surprising. And then, any kind of development, whether it's learning disabilities, language problems, even autism, we didn't have enough numbers for me to tell you that it was 4 or 5 times greater for autism. The numbers were small, but even autism, there was a signal that it was related to vaccines. And then here's the other one. This one just actually blew my mind, although I wasn't surprised. Unvaccinated kids rarely get sick. And when they do get sick, they get well very quickly. In other words, they recover quicker. And the severity of their illness is less. So when you vaccinate, you're going to see a lot more illness. And we're talking ear infections, sinus infections, lung infections, eye infections, skin infections, all infections combined greatly increased in the vaccinated. I knew this because I had 2 waiting rooms. I built my office and set it up with a unvaxxed room. A well waiting room and a sick waiting room. I just didn't want well babies coming in and sitting in a waiting room full of sick kids. Made no sense to me. And that's what most pediatricians have, is one big waiting room. All kids are in there together, catching the well babies are catching the illnesses, the infections that the sick kids have. When I started, those 2 waiting rooms were about equally busy. By the time I retired in December 2022, there were rarely any patients in the sick waiting room. And the well side was standing room only. It was packed. It was like, wow. I mean, talk about palpable. Clearly, something we were doing was making a difference. And I would say that the 2 most important things we were doing, number one is everyone was recommended that you get enough vitamin D. That helps your immune system. So you want to boost your immune system, be able to fight infections. You need adequate D. And the other big thing was the vaccine issue, because clearly vaccinated kids were getting sicker. And I had a growing population of unvaxxed. And as we went through the years, more parents were choosing to do less and less. So that difference was significant. And as I said before, who gets you sick? We were coerced during COVID. You remember that you gotta take your COVID shot or you're gonna kill grandma, right?
Right.
I'm like, no, it's sick kids who are a threat to grandma. Who was getting COVID? It was the vaccinated. We now have the data. The more vaccines you got, the more likely you were to actually get COVID. Natural infection creates natural immunity, which is much more robust and lasting. And that's what protects grandma, and that's what protects the population. So we went down the wrong path with our vaccine program, and certainly COVID put a big exclamation on that.
Absolutely. And we're going to be getting to the immunity issue soon. But I wanted to ask, what what surprised you? What chronic illnesses did you see, and maybe not even chronic, but what illnesses did you see in children that you now think we as a population have been desensitized to, that we think that this is just normal? But
Yeah.
seeing this unvaxxed population, what do they not have that the rest of them have?
Yeah.
What are the top ones?
So it's those 3 areas of conditions. So it's infections. The unvaxxed have fewer infections, less severe infections. They get over it quickly. And it seems like all infections. Having natural immunity is so superior to vaccinated immunity that was a surprise, honestly. I mean, not a huge surprise like I mentioned, but that's a surprise. And why do we vaccinate? To prevent infections. And so
Mm.
someone might say, well, but Dr. Paul, um, we're vaccinated against really dangerous diseases. Mm, they might have been dangerous in the 1800s and at the turn of the 1900th century in 1900, like 125 years ago. These diseases are not a big threat today. None of them.
Mhm.
And we could
Mm.
certainly cover them one by one or whatever. So the to vaccinate because of infections, no. But what the biggest difference that was surprising to me was the extent of the allergy, autoimmunity, and neurodevelopmental issues. These are chronic conditions that won't be picked up by most research because the research is so limited in scope and how long they look for these.
Mhm.
Autoimmunity takes months to years. And so most vaccine trials will not detect that. So the population and the doctors out there are not even aware. When they see an autoimmune condition, they have no clue that it's related to the vaccines. When they see infections, they have no concept of the vaccines might have made this more likely. And then the neurodevelopmental stuff. Autism was the canary in the coal mine. Autism is the elephant in the room. We don't know what causes it. Baloney. We absolutely know. Not all autism is caused by vaccines, just like not all chronic conditions are caused by vaccines. It's toxins, it's glyphosate, it's other toxins in the food, pesticides, herbicides.
Mhm.
There's so many toxins, but vaccines, you are injecting the toxins. You're bypassing the body's natural ability to keep toxins out of the body by injecting them. When we inhale, when we eat, when we breathe, the immune system of the mucous membranes of our body is right there to say, out, you're a toxin, you don't belong here, or you're an infection, you don't belong here. But when you inject,
Yep.
it's like mainlining. Yeah.
Right. And that's why everyone is talking about the gut, why the gut is so important, because when you think about toxins, like ingesting toxins, they go to your stomach. But and that's why it's important to have a healthy gut. But when you've got vaccines, they bypass the stomach. So there's no way to really fight it, go straight in.
Yes. So what happened with COVID, that was a coronavirus. Kids have seen coronaviruses before. There were 4 of them that are circulating, causing the common cold. And I remember the last 5 to 10 years of my practice, when I had a really sick kid, sick enough to possibly be hospitalized, I would do a panel of 30 different respiratory agents, some bacteria, some viruses, to see what might be causing this kid's illness. Because if it's bacterial, there are antibiotics that can be life-saving. Sometimes it was coronavirus, and sometimes it was all the other possibilities, right? There's a long list. When you have natural immunity, your immune system recognizes the entire sequence of the coronavirus. So kids did fine with SARS-CoV-2, the virus that we're pretty clear now was created in a lab by inserting, the spike protein, for example. That was the problem. That whole, I don't even like to call it a vaccine because it was really genetic manipulation to make the body create spike protein, the toxin. What insanity is that? Well, kids were able to see, okay, here's this new SARS-CoV-2 virus. We've seen this before, out of here. A natural immune system would take care of it because the natural immune system resides in the mucous membranes of the nose, throat, lungs, the GI tract, stomach, intestines. It says out, and kids did fine with coronavirus. I was in practice until December 2022, so the first wave of COVID, and I have a single kid hospitalized, no deaths. In fact, I've had no deaths from any diseases for which we have a vaccine, period.
Now, I remember you started the podcast Against the Wind at that point, and you were talking about how you fight COVID, and you were laying out the protocols. It was very helpful. And we're going to get to that a little bit later, but I did want to continue on with your story. So the Oregon Medical Board said, prove that your way of doing things in your practice is safer or more effective than the CDC schedule. You do this study, you find out that the unvaxxed are wildly healthier than the vaccinated. And then what happens?
I get a call, I think it was 3 or 5 days after our study was published online, International Journal of Public Health. And my attorney says, you cannot go to your office. You cannot contact any patients. Your license has been emergently suspended. You are considered a threat to public health. So their response to one of the most important studies that had ever been done in real world. So these are actual patients in one practice, so the variables are controlled. I mean, everybody gets the same information. They're all told to breastfeed. They're all told to take vitamin D. They all come in for their well visits. In fact, the unvaxxed made a higher percentage of their well visits than the vaccinated. So it was like a very good population, large sample size. Every practice, every health system in America should be pulling out their unvaxxed, age matching them, and looking at the difference between all health outcomes between vax and unvaxxed. So yeah, I lost my license like boom. And when you lose your license, it is pretty much close to death to your practice. So you lose all your contracts. Insurance contracts go away immediately. I ended up losing my board certification. I'd been 30 years board certified pediatrician, which means you're up to date. You pass tests every 7 years. You are, yeah, you're one of the top pediatricians, if you will, that stays up to date with what the information is you're supposed to stay up to date with. Um, yeah. So the practice started dying as a result of these actions. And
Mm.
that was, you mentioned with Against the Wind. I'm driving along one time, I'm listening to Against the Wind, the song. I'm thinking, oh, that could be a show. That's what I'm going to do. I'm fighting the board. I was in this fight mode. I ended up changing it to With the Wind because I felt like
Yes.
you never want to be against something. You want to be for something. You want to turn negativity into positivity. So With the Wind was the show this became. But initially, I was in a fight. I was in a fight for my license. I was in a fight with a system that seemed extremely well financed. I mean, they ended up hiring a second investigator to just pursue me. I had a booming YouTube channel, and I would get letters of inquiry from the medical board questioning me about something on YouTube. I mean, they were scouring everything. It was quite distressing and
Yeah.
expensive.
Uh, I thank you so much for the stance that you took and being so vocal. I can't tell you how many children you've made healthier because of your stance and lives saved. I mean, I look at my little almost 5-year-old son and I think I just had a tug at my heart that if I vaccinated, there were going to be some neurological ramifications. And I can't tell you how healthy he is. And it's true. When he gets sick, he gets a fever. It's a high fever. He's sick for a day and he pops up the next day ready to go.
Yeah.
I've not seen that with my others. They might not have as great a fever, but it's days.
Yeah. So you are sharing this story that I heard hundreds and hundreds of times, Stephanie. When pediatricians started kicking people out of their practice for not vaccinating, the phenomenon that I witnessed was first child gets vaccines, regresses into severe autism or spectrum or other neurological developmental issues. And the parents go, I don't want to do this to my next kids. They go to the pediatrician and say, no, this is what happened with our first kid. We don't want to do this. And they get kicked
Mhm.
out. They come to my practice and I say, here's the risks, here's the benefits, you decide. And many of those parents smartly, as you've figured out, chose not to vaccinate. Clearly, you had risk factors. And actually, by the way, most of us do. When none of us are walking around with the perfect genome, right? Like we have no risk factors. We all have risk factors. It's just a matter of how serious are your risk factors and how toxic is the environment. Well, the environment's gotten so toxic that I think it's affecting everyone. So every single child that's following the CDC schedule, honestly, is being affected. Now it may be subtle. You may not notice. Let's say you've got superior intelligence in your genetics and your kid might have had an IQ of 130, 140, a genius, and they end up at 120. They're still brilliant, right? So you don't notice the change. You don't notice subtle changes in development, but every child is affected. Unfortunately, too many are now seriously affected, as we've started to talk about.
Yes. And I was one of those moms who were kicked out of their pediatric practice. I have a
Yeah.
vaccine injured first child. The second one, I didn't wake up fast enough with, but fortunately never got the MMR with her. And at that point, my son was born and we just stopped. We saw the movie Vaxxed too on top of it. And
Uh,
I must say, My husband and I, after we watched that the spring of 2020, we were staring at the screen for like 5 minutes after the screen went black. We were like, everything we're seeing in person is in the movie. I mean, it
Yeah.
was like, it was scary, scary.
Yeah. I highly recommend parents to be watch the whole series. There's 3 Vaxxed movies now. In fact, there'll be a 4th complement to that coming out in the near future. But what you're describing, as a pediatrician, and I got to see this and most pediatricians don't. When you kick somebody out of your practice for that's intelligently not wanting to vaccinate to cause the same problems they already saw in their child, you don't get to see what I saw, right? So I was put in this unique position of sitting across from parents like you, listening to stories of, devastating medical situations that would arise, often autism, but, lots of things. But autism was that big one, right? I mean, it's so devastating to have a normal child regress into nonverbal severe autism. Those kids are in pain. They can't communicate. It's it's just, you wouldn't wish that nightmare on any parent. And
Mhm.
then the parents are being told, well, it wasn't the vaccines. We don't know what causes it. And you're almost made to be like the problem. There's something you did to cause this. No, no, it's the toxins, and the number one toxin is in the vaccine. So I sat across from parents every week. At one point, I was getting 4 or 5 new parents to my practice every week, and they're bawling their eyes out. They're telling me the story of what happened to their first child, and it's real. These are real people who are telling you what happened. We don't question a parent who got some penicillin or amoxicillin and gets a rash, and we know that's an allergy. But somehow, when it comes to neurodevelopmental issues or autism or chronic conditions, we don't make the connection. Well, that time is long past. My study isn't the only one. There are several.
Do you think it's willful ignorance, nefarious behavior, or completely just plain brainwashed?
All of the above. So I remember when I was in practice with 4 other pediatricians and I was waking up to what was going on back in the early 2000s, I would share books with them that had the information that was concerning. And they didn't want to read it. Okay. And then when I finally, after those 4 cases of severe autism that were triggered in my own population, I went to my partners and I said, I can't do business as usual. It makes no sense to give hepatitis B vaccine to newborns when mom doesn't have hep B. I mean, that just makes 0 sense. It's all toxins, no benefit. Why on earth would you do it? They said bye-bye to me. They said it is unethical to not follow the CDC schedule. And I'm going, it's unethical to follow the CDC schedule when you have so much data as we were developing at that point. Today, the data is overwhelming. I mean,
Yeah.
it's the reason I had to write Vax Facts was that the information in the vaccine friendly plan, a lot of it's still valid as far as child development stuff, all that's good. But the vaccine recommendations didn't take into account this new data we have, multiple studies comparing vaccinated to unvaccinated. And that's what needed to happen. And so when my own data came through, and then there have been others since, and a couple smaller studies before, it's so clear that vaccines are causing a lot of harm that we need to just pause and go, wait a minute. If we're going to use vaccines, we need to test them properly for safety, which I was really happy to see RFK Jr. has put that forward, that going forward, vaccines need to be properly tested with a placebo and for long enough to look at all health outcomes. It's like, okay, now, am I anti-vaccine? No. If you can do a proper study and show absolute safety for a disease for which there's real harm, real threat, right?
Right.
But right now, every single vaccine on the childhood schedule is more dangerous. I have it in Vax Facts in the book. There's a table in the back in the appendix. You are more likely to die from the vaccine than you are from the disease for every single vaccine on the childhood schedule. So parents are worried about death. That's number one worry.
Mm.
I don't want to lose my child to measles or whooping cough or tetanus or whatever. Well, do you want to lose your child from a vaccine injury? I would say no. You don't want to lose your child, period. Okay. So which is more dangerous? That's what you need to weigh as a parent, the pros and
Mm.
cons of choosing to vaccinate or not. And today in our world in America, and actually in most developed countries in the world, you are much more likely to have your child die from the vaccine than you are from the
Mhm.
disease.
That's right. So I was actually just having a conversation right before this interview with someone who said they would totally give their child the whooping cough vaccine, which is pertussis, correct? And that's only found in the DTaP or Tdap
Yes.
or whatever they call it now.
Yes.
But you can't get the single vaccine of pertussis anymore. It is
Yeah.
all the combination. It is the combination of it which makes it so dangerous because it has not been tested together and it's been not been tested with everything else. But then I did say now wait a minute. If you look at the data, I believe I have this correct that many of the children getting whooping cough actually are getting it from vaccinated children within their own home. Do I have that right?
That is correct. So whooping cough, if you're a pediatrician and you went through training, you may have seen a case of whooping cough in the ICU where a child is on a respirator or they need some oxygen. It's rare that kids get that sick, but it happens. And then there are these rare, very rare deaths. Uh, some years, none. I think it averages out to about 4 deaths per year, more or less, depending on the year. Think about this, there's 4 million births roughly in the US per year. So that's 1 in a million, your chance of dying from whooping cough.
Mm.
What's the chance of dying from the actual vaccine? I think it's like 8 times greater than that, 7 or 8 times greater. So just looking at that, but there's a lot of problems with that vaccine. It doesn't uh, prevent you from getting colonized, and it might reduce your infectious symptoms a little bit, but you are now actually more likely to transmit whooping cough than certainly than somebody who got natural infection from whooping cough. And in fact,
Mm.
those who've been vaccinated are getting whooping cough over and over and over again during their lifetime. Whereas if you have natural immunity, you're protected. And this is true for so many vaccines. So
Yes.
you've got to look at all the information. It is correct. Whooping cough can be deadly, but they're missing the other side of the equation. The vaccine is even more deadly, and the vaccine is not protecting. It's not preventing transmission. It's really a big part of the problem. They need to go back to the drawing board and see if they can create a truly safe vaccine. And there's no incentive for the pharmaceutical industry to change the products that they have on the childhood schedule because of the 1986 Childhood Immunization Act. Removed all liability from pharma, from doctors and nurses, all of us, anybody who's involved in giving these vaccines. If there's a problem with the vaccine, doesn't matter. You can't be sued. So why would pharma want to change their gravy train? I mean, they're making billions of dollars on these vaccines when there's no liability. The whole system is upside down, messed up.
Yeah. Well, you're talking about immunity. Could we talk about the immunity in adults like myself? So we got the MMR. We'll just take the MMR. We got the MMR when we were little, but now later on, where our immunity wanes uh, quite a bit later on in life. Now we have a what they call a measles outbreak, right? So we don't know exactly what's going on, but there's something going on down there. But um, the question is, we had Kennedy come out and say the measles vaccine is the most effective way of treating a measles outbreak or treating a measles infection. Or maybe it didn't say infection, maybe it was just
Probably
outbreak.
preventing further cases of measles.
That's correct.
Yeah.
So,
So
in a way, okay. Yeah. In this culture where people like myself, our immunity is waning more, I guess my question is if we keep vaccinating, but then halt vaccinating people, what does that mean for an entire society?
yeah, it's a very complex situation. Okay. I think it it's absolutely true. Your statement is correct. vaccine-induced immunity wanes over time. So it's not as robust, it's not as long-lasting as natural immunity. So I always
And
want
not
to make
given to the and not given to the children either, correct? So my children didn't get it from me,
yeah,
immunity in any regard when I was
right,
pregnant with them. Okay,
right.
go ahead.
So that's a very, very good point. The If you were born before 1957 or in 1957 and earlier, like I was, I'm immune for life. Natural immunity. I had measles as a kid. If you had been born in that era, you would have transferred immunity to your babies, right? So they would be born with protection. You're absolutely right. Because you were vaccinated, there isn't really much protection that goes to the newborn. And so children today are not born to 60-year-olds and older. Children today are not born with natural protection. They have minimal protection, and so they're at slightly higher risk of catching measles. But here's the thing: measles is not something to be feared. The two deaths that were described in Texas, it turns out under intensive review of their records, they didn't die from measles. They died from other things. Measles
Mhm.
rarely kills kids. I mean, so rare that we hadn't had a death, and I still would declare to this day there hasn't been a death in the US for over a decade or two, because those two cases were shown not to be deep measles deaths. So, we have cases every year in the US, and this year is going to be one of those high number years. It happens. Every few years you have a blip, and there's, hundreds or even over 1,000. We're going to probably hit over 2,000. It's going to be, whoa, the sky's falling. This is the worst year we've had in decades. Probably true. And the thing is, though, it's not that fatal. The other side of it is, how scary is the vaccine? That
Mhm.
is one of the scariest vaccines for triggering real problems, including death. So remember, you're still more likely to die from the vaccine. So what should parents do? Kennedy is right. If you're in a huge outbreak and it's ongoing, if there are enough people without immune protection, the old people who lost immunity over time, like yourself, now you could get yourself tested, by the way, if you're in your adulthood and you got the MMR vaccine as a child, you can get IgG against measles. It's a blood test, and see if you're immune or not. And I don't know the exact data on this. I haven't looked at it recently, but there's a growing percentage of adults who no longer have protection. So they're out there, they can get measles. We don't really hear a lot about measles deaths, do we, in adults?
No.
No.
Nope.
So that's because I believe even the vaccine-induced immunity, because they're using live viruses, I mean, these are not killed. They're actual measles virus that uh, is pretty robust. I mean, able to cause measles-like infections and rashes in a lot of the people who get the MMR today. So it is probably still giving reasonable protection. It's not that it doesn't give reasonable protection. It's just that the risk benefit doesn't balance out.
Mm.
In my opinion, not medical advice, it's not worth the risk.
Mhm. All right. So, what have you read for something like measles, or really any of these concerning um, childhood illnesses? We could say. Um, what have you read that is the best way to handle those, to treat those? It's
Sure.
almost like we have to go back to the way things were done 200 years ago and completely relearn everything.
Right. So the foundation is a healthy diet that's minimal toxins, or organic if you can, and you're eating real food, not processed food, not junk food, not highly inflammatory foods. You've got a biome you mentioned earlier in our talk here that, a healthy gut, a healthy biome is really, really important for your immune system. Let's just say, okay, you didn't do all that and your kid got measles. What do you do? Well, in the case of measles, there's a protocol, and even the Academy of Pediatrics has this recommendation for high dose vitamin A for a couple days. And you don't want to do long term high dose vitamin A. It's very toxic. It's like the only vitamin really that can cause you problems if you take too much. But it is absolutely helpful at reducing deaths. And so you can do that. And you can on this one, you can talk to any pediatrician. They will guide you on the dose.
Mm.
I talked about vitamin D. Make sure you're optimizing vitamin D, vitamin C. Humans are one of the only mammals that doesn't make their own vitamin C. We are highly deficient unless you're eating plenty of high vitamin C foods. And most of us aren't eating enough to really get enough vitamin C. Vitamin C is very helpful for immune system. Talked about glutathione before. It's one of your major molecules. You can support that with NAC and acetylcysteine. So there's a number of things you can do, as well as just eating well, resting. Don't be afraid of fever. Fever is how our body fights infections. We tend to rush in and get acetaminophen, Tylenol. That is the worst thing you could do if you have acetaminophen or Tylenol in your house for children. My proposal would be throw it out.
And why is it so poor?
So acetaminophen blocks the production of glutathione, and glutathione is such an important molecule to detox and to fight infections. So it is the absolute worst thing to do is to take acetaminophen or Tylenol products when you have an infection. So it's absolutely the wrong thing to do. Get the fever down if you must. When it gets to 103, 104, your kid's delirious. They're so uncomfortable. You've got to get it down. Just get a wet, lukewarm washcloth, move it around the body. As that water evaporates off your body, the fever comes right down in minutes. And then there are other natural ways you can try to keep fever down, but no acetaminophen.
Hmm. Well, I wanted to ask one more question about your book. Your book is, great title, Vax Facts, What to Consider at All Stages of Life. Um, what what shots are adults being offered now? And what effects are you seeing on those adults who take
Yeah.
them?
So we have a chapter for pregnancy. Obviously, pregnant mamas are adults, and there are now 4 shots being offered for pregnancy. Please read that chapter if you're pregnant or about to be pregnant, and understand that there's no safety testing. It's illegal to test pregnant mamas. So you are participating in a grand experiment.
Right.
Intuitively, moms know when you have a baby in your womb, you're there to protect and nurture. And there can be nothing more dangerous and ridiculously stupid than injecting toxins intentionally. We know that infections while you're pregnant are a bad idea. The immune system is downregulated to let that baby accept the baby, right? You got a little foreigner in there. They're only half you. So they're half your husband or whoever, so
That's
it's
right.
a time to avoid infections because we know certain infections can trigger autoimmune conditions, can trigger neurological problems. But why would you intentionally trigger uh, an immune response that could be harmful? So that one's an easy, absolutely nothing during pregnancy. I said that in the vaccine friendly plan. I repeat it again in Vax Facts. Please, please just do no harm first. It makes no sense. And I cover them all in detail. There's also a chapter just for adults. I added that because I watched my own parents who, my mom passed, probably due to a COVID shot. I could not convince her not to take the COVID shots. And, if you're sitting there watching the news as she was, and you're hearing misinformation and propaganda from people who are intentionally distorting the facts,
Mhm.
but you believe those facts, then it was so hard. I think everybody around her was getting them. I couldn't visit her for a year because you had to be vaccinated to go into that facility. It was a beautiful retirement community. But anyway, I saw what she was going through, what my dad was going through, wrestling with, do I get these vaccines? I mean, you go in now as an adult and you're elderly, they want to give you a shingles vaccine. They want to boost you for tetanus and pertussis. They want to give you a flu shot. They want to give you a COVID shot. And they've added Prevnar now, the pneumococcal. So, I mean, that's 5. And they can say, oh, we can do them all at once. Oh, no. I mean, you know, several of those are so toxic, and we put them all together, it's insanity. But,
Yeah.
that generation, more so than the newer kids coming out these days, were taught to respect their doctors, and doctors were held up very high. And if my doctor says, then that's what I need to do. It's time, folks, for all of us to take our health into our own hands, because unfortunately, the medical system has been completely captured by massive interests that are conflicted, at least financially, if not worse.
Absolutely. Take your health into your own hands.
Yes.
Yes. Oh, wow. Um, wow. So, Dr. Paul, I heard that you have been dealing with your own health issues. Did you want to talk about that a little bit and just talk about how you're combating it?
Sure, Stephanie. I'm not afraid to share my journey. I've never been afraid to talk about it because I think it might help somebody, right? So I'm a guy, obviously, um, and men are highly likely to get prostate cancer. And I have a recent diagnosis. Thankfully, it's stage 1, which uh, there's a true statement, and I've researched this, and it's absolutely true. Most men will die with prostate cancer, not from prostate cancer.
Mhm.
So that's my plan. You can knock out cancer, but there's something about cancer that, I mean, actually, all of us have cancerous cells that come up in our bodies periodically, and our immune systems take care of it. That's
Mhm.
why we don't tend to get cancer. Why do older people tend to have more cancer? When you age, your immune system is less robust, right? So you are less able to fight cancer, to fight infections just with age alone. So, um, my approach, and this is where, I'm going to just share what I believe to be really important information for anybody that's experiencing cancer as something that's visited your life. You need to really look at all your options, especially those that are outside of the mainstream approach. Mainstream medicine, almost like the vaccine issue, cancer therapy is surgery, radiation, and chemotherapy. That's it. I have a son who had a really dangerous, high grade appendiceal cancer, and I went on his journey. He's doing well, but boy, when he went in to see his regular oncologist, they wouldn't even consider IV vitamin C. I mean, it is
Mm.
so well proven that high dose vitamin C is anti-cancer. I mean, it actually can kill cancer cells. And the doctor just goes, "Oh, no, you can't do that. That's not on the protocol." And he's going, "But it's been shown it might be helpful." Well, it's not on the protocol, and you could get gallstones. And I was listening to this just thinking, he could die from his cancer because he really had a more dangerous cancer. But no, you could get gallstones. Who cares about gallstones? We can zap those. I want to survive my cancer. So anyway, many of your listeners may have heard of febendazole, mebendazole, and ivermectin. Ivermectin really reached some level of notoriety with COVID. It is very helpful at boosting your immune system. Guess what? Boosting your immune system helps you fight cancer and infections. And so there are people out there that are having great success with ivermectin, and you can add mebendazole is the human version of the same thing that's febendazole for veterinary use. Those compounds are pretty close to identical. So people are having great success with all kinds of cancer using those products. There's also there's a host of other alternative things. So there's a test that currently is still available only in Europe called the RGCC, and with that test, they can actually identify tumor cells in your blood and then test your very own tumor cells against all the agents we know might be helpful, mainstream chemo and alternative agents. Imagine knowing exactly what you should use. And in fact, my son had this done on his, and he
Mm.
goes to the oncologist and goes, "No, we have to follow the protocol," even though his cancer didn't even fit the protocol for which they were using because it was so rare.
And do we
So
know that the person or the company behind that test does not have vested interests in things like chemotherapy or radiation? Like, how do we know that they have no monetary incentives to put it a certain way to skew the test? You know what I'm saying?
Um, I think because of the thoroughness of that particular test, the RGCC, you're getting maybe 6 to 10 chemo agents that are tested, but you're getting another 20 to 40 alternative agents. And I may be
Mm.
underestimating the numbers, but I mean, they're looking at everything. And this is
Okay.
important because there's also things you can do with chemotherapy. I'm not specifically at this point talking about my own journey. I am treating my own cancer naturally at this point with, you know, ivermectin, mebendazole, other supplements, and using the RGCC to target it, and we're going to take the journey. I mean, it's a matter of, with any cancer, you need to figure out what your markers are so you can follow it and know whether what you're doing is helping or not. Okay, that's really, really important. In prostate cancer, it's so easy in the sense that we have PSA to follow. And so that's a blood test, you know where you're at. And if your PSA is heading up into higher and higher levels, whatever you're doing isn't working. So you move on to the next thing. You can have a whole system of what you're going to do. But yeah, there are exciting things in the alternative cancer world that I want people to explore if you're facing a cancer diagnosis.
That's awesome. One more question about this red light therapy. What do you know about it? Is it helpful? What are the specifics on it, if you know?
Yeah. So it absolutely is helpful for many cancers. They actually do a test on your cancer cells for RGCC for how thermosensitive it is. And, I have a thermosensitive cancer, as did my son, which means what he's doing, I mean, he's really hardcore. He's doing sauna 3 times a week at incredibly high temperatures. He's getting his body temperature up to 105 degrees. I mean,
Oh,
that is not easy to do. And staying in there for long enough to where that's going to have a cancer killing effect. And then he actually follows it with an ice bath and does it
of course
again.
he does.
Yeah. Follows it with an ice bath, gets back in and does it again. He does 3 cycles 3 times a week. It's like, wow. But, red light therapy is a lot easier to do, and it's actually creating some benefit for sure.
Mm.
For most, not all cancers are thermogenic or sensitive to heat.
That would be an interesting test to look into for those who have cancer. As listeners would recall, one of our former guests, Paul Mann, a federal employee coerced into getting the shot to keep his job, uh, developed turbo prostate cancer, and he was given just a couple months to live. And he was did chemotherapy, he did radiation, he did everything. And he found out later, and he worked with Dr. Kathleen Ruddy to combat it with ivermectin and a couple dietary changes. And then within a couple months, he was in remission. And this is being told he was going to die within a couple weeks several times. But he found out later that prostate cancer is actually one of those cancers that does not do well with the radiation and going the traditional direction. Um, and he was just shocked that that was the protocol. I mean, for basically all the cancers, this is what you
Yeah.
do.
Yeah.
And
So
there's no acknowledgement.
right. Mainstream chemo is based on maximum tolerated dose. So this is the approach. It's been that way for decades. You pick the chemo agents that their research has shown are most effective for your type of cancer, and you give a dose that is so high that that's why people lose their hair, they lose their lining to their GI tract. It's so toxic and to your immune system. Your blood counts drop off. I mean, you are so affected. All the rapidly dividing cells are basically shut down or killed. And that's why it's so dangerous. I mean, so many people end up dying because of the chemotherapy induced
Mm,
immune problems. They can't fight
mm.
infection. They're left unable to defend themselves. And that whole approach is so unnecessary, I would say, in most cases. I'm not an oncologist. I'm not giving medical advice. I'm just giving you an opinion based on really deep dive into the data and the research that's out there. There's a really intriguing way of handling chemotherapy. If you get to the point where you need chemo, and in the case of the RGCC directed chemo, you know exactly which agents are going to work best. You can do something called insulin potentiated chemotherapy. My son did this. It was fascinating to watch. So most cancer cells want sugar. They are dividing so rapidly, they need a lot of sugar to be able to do that. So if you can starve them of sugar, one, it's going to kill a lot of them, but two, it makes them so hungry they're going to grab onto whatever's there. So with insulin potentiated chemotherapy, you fast for a day at least, and then you come in and you're actually given insulin by IV. Insulin drops your blood sugar. So my son would come in with an insulin of around 80. He's already been fasting, and take it down to where he was sweating and shaking. And I mean, you can die if you take too much insulin. And then they would inject him with a low dose, 10 to 20% of the normal dose for chemo, and sit in that for 10 minutes. And then they would let him drink juice and give him sugar solution in his IV. And those cancer cells that are still living are going to gobble up the sugar and the chemo. And we know it was working because even using 10 to 20% of the standard chemo dose, it was dropping his white count some, not as dangerously low, but some. So there's fascinating things you can do for cancer therapy these days, and look into it.
Now, was he working with a traditional doctor on that?
No. The traditional doctors, all they would offer is maximum dose chemo.
Okay.
And then we would follow that with, either surgery or radiation. He did have surgery. He had a large mass in his appendix, blocking most of his colon. And thankfully, they got that fast. And he did not take the COVID shot, by the way. People always wonder. I didn't either. Um, we have seen so much cancer, as you called it, turbo cancer, where it just seems to come out of nowhere. And before you know it, it's end stage. And I wonder about, former President Biden. I mean, we just got the news recently, right, of his, it's already in his bones. So that's stage 4 prostate cancer. And everybody's saying, oh, they had to have known. Not necessarily. I seem to remember pictures of him getting the COVID shot on TV and encouraging everybody to get the shot. And when I saw that at the time, I was thinking, oh, I bet he's just getting saline, thinking that, they would know not to do that. But he may not have known. He may have actually gotten the COVID shot and now has cancer that comes on, boom, really fast.
Yeah.
But
I always
anybody
Go
like
ahead.
former President Biden, if I were giving him advice, it'd like jump on these alternative things hardcore. You could actually survive this, as you pointed out with your other story.
Yep, absolutely. I do sometimes think, though, what we're being told in the news about all of this true? Because there's so much lying that went on in the past 5 years that I question everything. So we may never find out the true story. But yeah, I would absolutely recommend he look into all the alternatives.
Yeah.
Well, Dr. Paul, thank you so much for joining me today. I have one last question for you.
Yeah.
If the average American citizen could do one thing to, in this case, boost their health, what would it be?
It's got to start with food and water. What you're ingesting, you need to avoid ingesting toxins, and so it needs to be real food. In addition to that, none of us are getting enough vitamin D because you get vitamin D through exposure to sunlight, and we're told to use sunscreen and stay out of the sun and all that. So you have to supplement vitamin D3 with K2. But yeah, start with a really healthy diet, and you need a sense of peace. Fear is not a good thing. And so, the whole world was put through this fear thing with COVID, and that reduces your immune system significantly. It's really harmful. So you need to just go forward with love and faith and community. Find a community that's supportive. And then if you're eating right and drinking right, provided you don't already have ongoing problems, that might be all you need to do. And read Vax Facts. You can go to vaxxed-unvaxxed.com. If you want to buy an author's copy, that helps support the authors. And my co-author, Dee Hoover, goes by Just a Mom. She adds little notes at the end of each chapter to make it digestible for people who maybe that's too much science. But this book is available anywhere books are sold. So I hope you'll read it, and it will change your life for sure.
I can't wait to read it. Thank you, Dr. Paul. Thank you so much for joining me.
Thank you, Stephanie. It's been my pleasure.
Thanks so much for tuning in. Please like, comment, subscribe to, and share our podcasts. I'll see you next week.